So I think welcome to our briefing today. Maybe we'll start with the county commissioner, who also co-chairs this committee on the prevention and management of COVID-19, to make a few remarks. Then I will also give a statement so that we can make good progress. One County Commissioner, thank you.
Okay. Thank you, Your Excellency. Good morning, all. Good morning, all. I think it's another day that we are here again for this important task, to give an update of what has been happening around regarding the fight against COVID-19. And for us, so far so good, because there are positive developments to do with the progress, both recovery and the fact that there are no additional cases is a good sign. But there are also matters of concern, and Nakuru is not left behind, although by mercy of God we are still pushing on well. First, we can appreciate what the security organs within the county are doing, what the medics are also doing as part of treatment, and also liaising with security organs to be able to handle situations that have been brought our way that require a multi-agency approach. And the members of public for notifying us about some few errant people who do not seem to realize that we have a problem to deal with, and thinking money and also social gatherings, putting them ahead of their own health. And it is for this reason that we are still appealing, first, that those living in areas frequented by long distance truck or the parking for those trucks, and their intensity of interaction is more noticed in Maimayu, Kikope, Barnabas, and Salga. Kindly be cautious on how you are interacting with the strangers in those areas. We are not saying that they are sick, but we also don't know, because nobody can be able to see this virus by eyes and say that this person has just been infected and may be a danger to me. I'm just appealing to the people residing in those areas to be extra cautious for their safety. I'm also appealing to people, no matter how much you love your people, in case of death, in case of functions, let's avoid intense social gatherings, overcrowded social gatherings, and the restrictions are still at 15 for barriers. Any gathering beyond that limit is an illegal gathering and is in contravention of the guidelines given as far as combating coronavirus is concerned. And it is reason that we already have 4 people, actually not 4, 5 people, who attended a burial and went to an extent of dressing the dead, and yet the dead was a victim of COVID-19. The 5 of them are at Kitina as we speak, in a mandatory quarantine. With the same breath, some 6 were found locked in a bar and enjoying their drink. And of course, there are those who are serving them. We have also taken those to a mandatory quarantine at Kiti, and they will be there for 14 days and they will pay the bill for themselves. We had even realized that one of them had a history that his cash bill at the police station had accumulated 20,000 and yet not willing to change. We will not relent and we will continue quarantining them at their own cost so that they can know and realize that they are endangering the lives of Kenyans. We have formed a multi-agency team to deal with the various matters of complaints that are being raised by members of the public in regard to violation. And let me sound a warning here. If there is anybody amongst us who is being given this sensitive information and leaking it, we will not relent on dealing with that person the best way that we know, including sacking a person who is compromising that kind of information. All that we can call upon is for our various officers and members of the public, in case you realize that there is any violation anywhere, just liaise with us and action will be taken promptly. And also, as that action is being taken, we know that our chain of management, especially the local administration, the national administration officers, and down to the sublocation level and also assisted by village elders. The chiefs should be in a position to know anything that is happening within the villages without any challenge. And will not hesitate to take any action against any administrator in whose area gatherings that are illegal are witnessed without any action being taken. Ladies and gentlemen, let's take this disease with the seriousness that it deserves. And for now, whatever action that we'll be taking, I don't think we'll have any apologies to make. Maybe if there will be any, is after we secure the population. We won't mind dealing with any issue. And for clarification, those who are already in forced quarantine for having been locked up in a bar, first of all, being locked in is a violation in itself, which means the owner of that bar must lose the license. Secondly, after completion of the quarantine period, whether they are positive or not positive, because they will have to be subjected to test, they will also face a legal action for violation of directives. And on top, it is them to meet the cost of that quarantine. So if somebody is willing to go to that extent, they can continue doing their merry doing. And at the end of the day, they will have consequences to face. So let's join hands. I'm just appealing to the people of Nakuru to continue giving the support that they have been giving so that we can continue fighting this pandemic with the seriousness that it deserves. With the same breath, we are forming a multi-agency team. We know there are loopholes to do with the restricted movement, especially in the bordering districts, counties, especially Kiambu. We suspect there could be a flow of traffic from all the way from Nairobi, which we want to join hands between the national government and county government so that we can seal all these loopholes that have been there. And I want to pronounce this. Those who are violating and trying to enter Nakuru from Nairobi or Kiambu, once we get you, we are also taking you for a forced quarantine first. Then you will be tested after that, because it is a clear indication that you have been reckless. If you cannot obey the simple guidelines, then it means maybe there is not the first violation. And that's why we are saying you become our first suspect. You will be taken to quarantine and later be tested, and after that, prosecution will follow. I think that is what I can say for now. Let's continue joining hands so that we can ensure that whatever we are doing at the moment, or we achieve our agenda of securing Nakuru from any infection. Thank you. Yeah.
Kizungumzia swala la wale wenye pengine wanapatikana wakitoa ujumbe kwa wale wenye wako kwa maeneo pengine ya Sudani. Siku ya Jumamosi kulikuwa na wale wenye walipatikana wakashikwa wakapelekwa bondeni, watu 13 na moto walikuwa kwa nyumba moja ya RMP sehemu ya Langalanga, wakapelekwa bondeni, walikuwa watu wamelewa, wakatiwa baadaye hawajapelekwa quarantine. Pengine kama umeweza kujua hilo na kufikia sasa ni nini kimekuja kuhusiana na polisi pamoja na wale wenye walikuwa ndani wamerudishwa bado?
What I'll say about that is that we have already agreed that the issue will be investigated, because I got wind of that information today. What we are doing at the moment is that those who are involved, including the MP concerned, will have to record a statement and we'll get to the bottom of it. If somebody erred in it, then action will have to be taken. But already a file has been opened for that. Yeah. That involves the various organs of law enforcers, which includes the police, DCI, national administration, and also the county government. Also, there is a critical unit called Critical Infrastructure Protection Unit. It will also be involved. So those are the people we want to involve. A special unit to deal with that, not necessarily those who are the local stations, so that we can be able to handle issues promptly and also be able to deal with those who are ill-bent, including any mheshimiwa who feels like they are above the law. If there is anything that incriminates that person, we'll deal with them in accordance with the law. Thank you.
Asante, Commissioner. Thank you. Kindly allow me to read a written statement on some of the issues that may be touched by the Commissioner and some may not have been touched. First, we wish to note that so far we have had 45 persons with suspected symptoms screened in our facility. And out of these 45, some of them were volunteer persons who came. Some were actually reported by members of the public. And out of these 45, as you may be aware, 2 weeks ago, we had 2 who turned positive. And after they turned positive, we treated them in our isolation center. And after the 2-week period, we tested them the first time. They were negative, and yesterday we also tested them for the second time, and they also tested negative. So we are happy for the good treatment for these 2 particular patients, and also for the members of staff who have been taking care of the 2 patients. We also wish to note that as we release them to go back to the communities where they came from, we are also tackling the bigger problem of stigma. They would otherwise have been here to probably give a statement or so, but as we all know, there is a rising problem of stigma, that persons who have been confirmed to have this disease, when you finally return them to their community, the discrimination and stigma from the very same community that should be supporting them has not been very good. So we would want to take this opportunity to request the immediate members of the family, the communities where these 2 patients come from, to help us in the reintegration of those 2 patients, so in stigma and discrimination as a key problem. So we would really want to urge the community there to exercise love and understanding, because any one of us is a potential patient for this disease. and we would want to be happy for those who have recovered and are returning back to the community. I also wish to note that the county prevention committee, working through our health care workers, we have had a total of 191 suspects who have been quarantined, and these were as a result of contact tracing. When you get one patient, you want to see where they have gone, and out of these 191 that we have quarantined, we have gotten results for a total of 186, and they have all been negative. We have 5 pending results, and we expect those results by tomorrow. But as of now and here, we do not have any confirmed case, because the 2 that had been confirmed have since become negative, and we are since releasing them back to the community. We are also planning to undertake mass testing for frontline healthcare workers who are exposed to the virus. We acknowledge their sacrifices and will ensure that regular testing is conducted as a prevention strategy. A special treatment center has been dedicated at our PGH annex, and it will have 4 ICU beds and a team specifically to deal with our healthcare workers. So should there be any instances when our healthcare workers have been confirmed or even suspected for purposes of quarantine, we have a special unit that will be dealing with this. But we are happy for now, we have no case of that kind. We have also noted with great concern about the exposure of communities living in areas frequented by long-distance truck drivers. These areas, as we have noted before, include Salga, Maimahiu, Kikope, Longonot, and Barnabas. These truck drivers move from Mombasa, they come through Nairobi, they go all the way past our borders to Kampala and even up to Kigali. And as we all know, some of those places where they are going across have already been closed because of the high cases. So as a result of that, we consider these particular centers areas of high risk. And consequently, we have started screening the truck drivers as they pass through these places. And so far, we have screened a total of 2,119 drivers, out of which 3 have community living in these areas to be extra vigilant in managing these visitors. Who come from areas that have previously had high cases of infection. Further, we also wish to note with great concern the blatant disregard for regulations issued by the government on behavior change. In particular, we are disturbed by bar owners who continue to use their premises clandestinely to offer their services, that is alcohol sales, to patrons, while their front doors remain closed. For those we shall nab in the coming days, you will have the rare opportunity of being the example that others will never wish to follow. In this regard, we shall revoke your license. We shall put your patrons together with yourself on quarantine for 14 days at your own cost. And we shall also name and shame such persons for their reckless behavior. And this is all done as a way of trying to deter recurrence of that behavior. Further, we also wish to note that the announcement of restrictions on movement from Nairobi to other counties, including Nakuru, continue to be violated with great impunity. We wish to call upon the National Committee to review the compliance to this order and in particular institute immediate remedial measures to instill discipline among travelers. And in connection to this, allow me to say that we have sent a few undercover teams, and they're able to drive from Nakuru almost all the way up to Nairobi. Nobody stops you, and then when they are stopped with a very flimsy excuse, they are allowed to pass. No letters. The few who have letters, many of them emanating from Nairobi, we also have noted that the teams doing this are not doing it in the strict adherence of the regulations given by the head of state. And to this extent, we also call upon the national government to reconsider the mechanisms put to allow movement, because non-essential movement should not be allowed. And as a county, we are aware of the grave danger of the continued movement of persons from areas of high infection to areas of low infection. And I think we'll do everything possible to invest in secondary measures to ensure we protect our interests as a region. The medical costs are much higher than the cost of preventing people from going from one place to the other. Further, the order by the National Committee for residents to wear masks has been well taken by residents. One of the major complaints that has arisen is where these masks would come from, and also more importantly, the cost, because many of them are in a dire situation. In order to complement these efforts, the county has instructed all our TVETs to commence the manufacturing of these masks with immediate effect. These will not only provide the much needed protection, but will also provide livelihoods across the county. In addition to our TVETs, we shall also enroll other teams on short-term basis to ensure that the masks are done to standard and also at the quantities that may be required within the county. Lastly, we wish to urge all the residents of Nakuru to continue observing the preventive guidelines issued by the Ministry of Health, and more in particular also to be patriotic citizens and report persons who are violating these regulations and whose consequences may be adverse for all of us. Thank you.
At the KCBU Nakuru or Southwest chapter, the secretary was actually complaining this morning that the healthcare workers and the medics are at risk, and was claiming that the PPEs that were supplied were substandard, and that some healthcare workers have not been promoted for the longest time that they have operated in Nakuru County.
Okay. What else? Okay, I think on the issue of the standard of our PPEs, maybe I'll allow the CC in charge to talk about standards. But I think on issues of promotion and other long-term issues, when the nation is trying to deal with a matter of this gravity, our position is that some things can wait. And I have made that very clear also to the trade unions and the doctors in charge, that we shall deal with matters that can wait. Right now, I think is not the time to talk about promotions and other things. We need to address the thing before us. And I think we are doing everything possible. On compliance to safety regulations, we procure through KEMSA and other entities that have already been allowed to do that business by the government. So I think this is a matter we would really want to look at, and we value workers in the front line, because if you remove 10 or 20 of your healthcare workers, then you are down, because they are the people you require to ensure that we continue with our treatment regime. So I think it's in our best interest to ensure that we protect our healthcare workers. And as I have already said, we are actually setting up a special unit specifically just for our healthcare workers. And I think this is not just for today. We believe that the relationship between the county and its healthcare workers must be a long-term relationship that is not just about the COVID, and we want to keep that relation going on. Allow me to invite, is there any question for me before I invite the CC? Welcome, Dr.
Thank you, sir, for the statistics. First and foremost, I want to let you know that the county government of Nakuru has invested a lot in promotive and preventive healthcare, and that is why maybe His Excellency has just announced today that in this county, as of now, we don't have a single positive case, and we have put the appropriate people who need to be on mandatory quarantine and those who need to be in isolation properly. So we are managing the condition well. As on PPEs, we exclusively buy from KEMSA, where every other county buys from. Unless KEMSA has a problem, which we haven't heard from other counties, I think we will give that complaint the contempt it deserves, because really KEMSA is the main supplier to all facilities, and it does quality goods, and we buy exclusively from there. Ladies and gentlemen, I would also wish to let you know that we should take a moment to applaud our health staff. The people who work in our isolation facilities in Naivasha, Nakuru, and Molo are people's spouses, relatives, and they have put themselves there, and now we can see results. At least 2 cases are out, and they have been with us for almost from 30th March. That is almost three weeks. If you took a moment to just clap for them, I would be very happy. Kindly. Thank you very much, sir.
Thank you. Asanteni. Thank you.
So